Thank you very much and good afternoon. While we were able to provide preliminary numbers over the last few days, I wanted to update that with some of the confirmed numbers from today and to let you know that the updated confirmed numbers will be posted in our statement later today, but also on the BC CDC dashboard. So in the last 24 hours, we have confirmed 2,944 new cases of COVID-19 here in British Columbia, and health authority active cases are as follows. There are 5,462 in the Vancouver Coastal Health Region, 7,192 in Fraser Health, 1,363 in Vancouver Island Health Authority, 1,576 in the Interior Health Authority, and 431 active cases in the Northern Health Authority, for a total of 16,014 active cases who have been tested across the province. One of the other things, of course, that we have been watching carefully is our hospitalization rates for people with COVID, and that is at 193 people hospitalized with COVID-19 today, 66 of whom are in critical care or ICU. And since December 24th, we've had an additional 5 people who have died in British Columbia from COVID-19, bringing the total number of deaths from COVID-19 to 2,419. And as always, our condolences and our thoughts go out to all of those who have lost loved ones during this pandemic. So a complete reporting of the confirmed data will be in the statement, as I said, later today. As we talked about prior to the holiday long weekend here, Omicron has left us with more questions than answers, but it also is different, and it is spreading through our communities in a way that is different from other variants that we've seen over the past 2 years. People are getting infected with a much smaller dose of the virus and much more quickly. And they are passing it on to others, often before they realize that that they're able to transmit it. The rate of transmission has impacted a number of different parts of our system that we've had in place, including the effectiveness of contact tracing. The incubation period is fast, and we've now seen that piece of the puzzle come together, both here in BC from the data we have, but also what we're seeing across the country and in other countries globally. The incubation period is now down to a median of about 3 days, from an average of about 6 days, with previous variants even as late as a month ago. Which means by the time you develop symptoms and get tested, get that result back, you will likely have exposed others and passed it on to some of them. And as we've seen before, it spreads to the people that we are closest with, the people we live with, the people we socialize with, our family, our friends, our social connections. As a result, we all need to be paying more attention. We talked about this before going into the weekend. Close attention to 2 things: how we are feeling and who we will be spending time with, to make sure that we're not putting people at risk. The puzzle is coming together around Omicron. We are learning more about how fast it spreads, how infectious it is, and it is very clear that it is increasingly transmissible with this shorter incubation period that now is more and more defined. We know as well that you're 10 times more likely to be reinfected if you have been infected before and are not yet vaccinated. And we know that Omicron is causing more breakthrough infections in people who have been vaccinated. But some of the things that we are learning is that particularly people who have 2 doses of vaccine on board, who have been fully vaccinated, regardless of how long ago that was, are much more likely to have milder illness or asymptomatic illness if they do get infected. But given this rate of transmission, if you have any symptoms of COVID-19, you really must assume that you have the virus and take measures to avoid passing it on to others. That means making sure that you're wearing masks in appropriate places, that you stay away from people who may have increased risk, and that if you are not fully vaccinated as well, you are more likely to have more severe illness. The best thing we can do is make sure that we're staying away from others if we are sick ourselves, to rest, drink plenty of fluids, and get medical help if our symptoms worsen. If you're having difficulty breathing, having chest pain, having difficulty drinking or eating, or your self-care is not helping you manage, then contact 811, or if you need to, make sure that you can seek immediate care and call 911 if you need to. There is additional details about self-management on the BC CDC website that can help you understand the things that can help. If you are a close contact of somebody with COVID-19, you do not need to self-isolate if you're fully vaccinated, but you do need to monitor for symptoms for 14 days, and you need to pay attention because you may be incubating it yourself, and you need to be extra cautious about wearing masks when you're around others and delaying gatherings and visits, particularly to people who are vulnerable. As many people have experienced, our testing centres are now at their maximum capacity, and we have been doing a lot of testing over this past few days, despite things like the weather and dealing with the issues that we've had with some of our testing centres. Our BC CDC symptom checker is a good tool to use if you're unsure about whether you need to get a test. The PCR tests, the more accurate PCR tests, are being used, and we're triaging those to make sure they're available for those who are highest risk, so people who have a high risk of having more severe illness, or for people who need to know whether they have COVID to be able to safely return to work, and particularly making sure that they are available to support our healthcare workers and emergency responders and others. Rapid testing that we have available in the province is now being used across the province to supplement at our testing centres for those who are at lower risk of having severe disease, but people with symptoms where it can help understand if they have COVID or not. If you are a healthcare worker, please do go and get tested and connect with your employment right away. The encouraging trend that we are seeing around the world is that for most people who are fully vaccinated, illness continues to be mild. And for many people, that means if you have mild illness, you can self-manage at home and you don't need a test. Booster doses are also providing added protection to those who are at highest risk, which is why we're continuing to follow the approach of 6 months based on interval from your dose 2 and age being the number one risk factor. I will say as well that we are continuing our surveillance reporting, the numbers I reported today, which are based primarily on our PCR testing. And that is something that has been consistent. We know that every day the case numbers have a lot to do with how many people are tested where and the capacity at our laboratory. But surveillance is looking at trends over time, and that is the other important things that we look at. So the 7-day rolling average helps us understand trends over time. As well, we have other surveillance streams that augment and support our testing. We look at things like the rate of testing in different communities in different parts of the province and by age. We look at the percent positive in our testing in the different places. We now have an online reporting tool for rapid testing, and that will give us a sense of how many people are reporting that their rapid test was positive. That's just another piece that helps us put together the picture of how this virus is moving through our community in this wave. As a result of the widespread transmission of Omicron, we are seeing higher levels of absenteeism as people become sick, with people needing to stay away from work. And we know that schools reflect what is happening in our communities, and this is affecting our healthcare system as well as other aspects of our society. With this in mind, I have directed the Ministry of Education through an order to take a phased restart for our K-12 schools over the coming weeks. All schools will open on either January 3rd or 4th as planned for children of essential workers and those with special needs, with full return to classes for all students on January 10th. This will give us time to add additional protocols to reduce crowding and stagger times for recesses, those things that we did early on that we know can help reduce the potential for transmission within the settings. As well, school administrators will use this phased approach to address things like making sure we can continue to safely have classes, to address absenteeism and program continuity. We'll also be working very closely with public health in our schools to adjust our testing strategy and to modify our public health notification and working with the schools to make sure that we can put in place measures that help us understand how Omicron is affecting the schools as well. So these revised protocols for notification of staff and student illness and absenteeism, given the spread in the community and the changes to contact tracing. And Minister Whitehead, who's here, will address these details in a few minutes. Whiteside, I'm sorry. So we are learning more. Every day, more of these pieces about Omicron come together. What we don't yet know for sure is how severe this illness will be as more and more people are infected, and how that will impact our healthcare system. We do know, and what we're seeing across the globe and here in BC, is that vaccines make a huge difference. Vaccines work. They may not stop all transmission, but our vaccine effectiveness at preventing severe illness is still very high, and we see that with data from the BC CDC. We've seen that in places across the country, where even older people who are testing positive are not ending up in hospital. And that is the good news right now. But we are not yet at that place where we can say that for sure, and we need to continue to monitor, and that's why we're taking some of these measures today. What we have done collectively has bought us time. It helps us understand more, to ramp up our vaccination, our booster program, to modify our testing so that we know we have the strategies in place that are needed. What we need to know right now is, this week we are seeing that hospitalizations in critical care are holding steady, but we still are having impacts, and uncertainty is still a challenge for us. But we will know more in a week. We are once again in a new phase of our pandemic, and we must continue to evolve and adapt our approach. That's why we're continuing to act to protect our healthcare system, our schools, our communities, and all of us. Despite all of our best efforts, we are not going to prevent this wave, but we do all need to continue to do our part to make sure that we're mitigating it as best we can. This means using all of our layers of protection are even more important now. And paying attention to how we are feeling and who we are spending time with. And we know that people will become ill with this new infectious strain despite all we are doing. And we need to support them. This is just what happens when you have a highly infectious respiratory virus. We need to offer compassion without judgment. And I know it's discouraging sometimes to think that despite everything we're doing, we are going to be exposed to it. We are seeing it move very quickly through our communities. But we do have control. We have control about the things that we can do for ourselves, to protect ourselves and our family, and to support our family. Things that we can do, including upping our mask game, making sure we have a good quality 3-layer mask, or using surgical masks or KN95s in those certain situations where we can't avoid indoor crowded settings. Getting vaccinated, we know that that is what is protecting us the most right now, whether it's your first dose, your second dose, or when you're invited for your booster dose. Give people the space they need. That is an important part of all of the different layers that we have. Keeping those barriers that we have in place, being respectful when you go into a grocery store or the drugstore, wearing your mask, giving people space. Those are things that we do to support each other right now. Avoiding crowds, and particularly if you are concerned at all if anybody in your social circle has COVID, if you're feeling unwell yourself, please do not go to visit your loved ones in long-term care. do not go to visit people who may be at greater risk from this strain of the virus as well. As we look to the end of 2021 and the start of a new year, we need to give each other a booster shot of kindness once again and make sure that we get through this together by being kind, being calm, and being safe. Thank you, and I'll now turn it over to Minister Whiteside.
Thank you, Dr. Henry, Minister Dix. My name is Jennifer Whiteside. I'm BC's Minister of Education, and it's an honour to be here today on the traditional territory of the Musqueam, Squamish, and Tsleil-Waututh First Nations. And I want to start by first highlighting the incredibly hard work that all of our teachers, our school staff, administrators, school leadership, district leadership, trustees, rights holders, parents, and of course all of our partners in the K-12 system, all of the work that's gone into keeping our schools open and safe over the last 2 years and providing crucial face-to-face instruction to students across BC. It is a testament to the monumental efforts of everyone in the system that BC has been able to continue delivering in-class learning while so many other jurisdictions did not. We know that face-to-face learning is important for the intellectual, social, and emotional development of students, and that schools are more than just a place of learning. They also provide important supports for students who may need a bit of extra help, whether that is in the form of mental health services or hot meals or other programs. So our primary goal is to continue the work to keep students learning safely in person for the remainder of this school year. The rapid emergence of the Omicron variant means that we have to ensure we have the foundations in place to keep our schools safely open. And that is why, as Dr. Henry has announced, we will have a phased approach for the return to school, with students returning to school on Monday, January 10th, staff returning to school next week on January 3rd and 4th. And this delayed start will allow public health and education time to assess the impact of the Omicron variant in our communities and on our education system. And it will also provide teachers, staff, and administrators time to prepare for students safely returning to class with enhanced safety measures. This additional time will also allow schools to proactively implement continuity of learning plans to meet the unique challenges that we face. During this time, schools will be open for students whose parents are healthcare workers and for those students with support needs who require care. Parents are encouraged to reach out to their school principal to make those arrangements. Over the past 2 weeks, Ministry of Education staff have worked very closely with the BC Centre for Disease Control and with all of our education partners to develop enhanced safety measures that are based on public health's current knowledge of the new variant. And these changes will be published in an addendum to the Provincial COVID-19 Communicable Diseases Guideline for K-12 schools and are in addition to the existing guidelines in our schools, which have continued to reduce the spread of the virus. Many of these measures will look very familiar as they were part of our original safety plans. As students head back to school, schools must reinforce the existing measures, including maximizing space between people and ensuring all who are able to wear a mask. Some of the enhanced measures that will be enacted include reinforcing the importance of the daily health checks and ensuring that you stay home if sick. Implementing strategies to prevent crowding during class transition times, such as staggering start and stop times or recess times, break times. Holding school gatherings and events such as assemblies in a virtual format. Holding staff-only gatherings virtually. Limiting visitors to those who are supporting activities that directly benefit student learning and well-being, such as teacher candidates, immunizers, or meal program volunteers. and pausing extracurricular sports tournaments. These guidelines build on existing protocols that have successfully minimized the spread of the virus in our schools. And these existing guidelines include encouraging everyone who is eligible to get fully vaccinated, cleaning hands regularly, cleaning and disinfecting surfaces at least once a day. And these measures are based on what public health has advised and knows are successful strategies. And as we have done throughout the pandemic, safety measures for schools will continue to be updated as needed in consultation and at the direction of public health. Schools will use the next week to implement enhanced safety plans. Staff, school leadership and district leadership will be determining their workforce needs and developing continuity of learning plans. As we know, the pandemic is changing, but we have shown that the education system is nimble, smart, and strong. And we are taking these proactive steps to reduce any further disruptions in our school year. Our efforts are truly focused on working to reduce disruption and reduce absenteeism in our schools. We know it's been a very long year for students. And while some may be excited for an extended winter break, we know that many families depend on our schools being open. And it's critical for them to have our schools running as smoothly as possible for the duration of the school year. But taking a few extra days now for planning and preparation, by doing so, we are setting up our schools for the best possible start. The ever-changing nature of this pandemic is challenging for all of us, and we are going to keep working closely with public health, with all of our education partners to ensure in the days and weeks ahead that we have the right measures in place to keep students and staff safe in schools. Thank you very much, and I'll turn it back to Minister Dix.
Thank you very much, Minister Whiteside. Dr. Henry, I just wanted to update you on a few important initiatives that are going on with respect to the COVID-19 pandemic. I want to firstly thank our healthcare teams across BC for the truly exceptional work that they did this weekend under challenging conditions. This Christmas weekend, well, there's certainly healthcare incidents, and the normal Christmas weekend was, for many of them, expected to be a time of greater rest, and of course it was not. Just to put that in context, on this Christmas Eve and Christmas Day, that 24th to 25th period that Dr. Henry, that will be reported on our 3 o'clock statement, or our statement that comes out after 3 o'clock, I guess it is now, 4 o'clock or 4:30. On that day, 19,681 lab tests were completed for COVID-19 in BC, 19,681. Over the weekend, the Christmas weekend and the stat holidays, 75,000 lab tests were completed, which represents each of it exceptional work by our nurses and our teams at collection stations and by our extraordinary teams in the labs at the BC CDC, the health authorities, and around BC, including at Life Labs. And we want to thank all of them for doing such exceptional work this weekend. I want to just note, because often we have talked at different times of the pandemic how regions are affected differently. With respect to the Omicron variant of concern, our 7-day rolling average of positivity is 14.49%, and that is virtually the same, with very little variation between all 5 health authorities. In short, our 7-day rolling average, I should say, overall for COVID-19, 14.49%. Obviously, that's higher yesterday than it was 7 days ago. So that's an average. It would have been about 10% 7 days ago, 20% yesterday. But that 14.49% is really the same in every health authority. So wherever you live in BC, it's important to follow public health guidance and public health orders. Secondly, with respect to our acute care capacity in the province and how many people are in acute care today. As you'll know, we have 9,229 base beds in BC, 2,353 surge beds for a total of 11,582 total beds. The number of people in acute care today is 8,669, or significantly less than it was, say, 3 to 4 weeks ago, but still a very significant number. And our challenge is to ensure that we have sufficient capacity to deal with COVID-19 patients and patients who are living and dealing with the Omicron variant of concern. In critical care, there are 510 base beds and 218 surge beds for a total of 728. There were 420 people in critical care in BC as of this morning. So we are making adjustments and creating a capacity for an expected increase in acute care and critical care patients. And as you'll see, the numbers aren't quite showing that yet, as you would expect. There's a lag effect here, but there were 206 people in hospital with COVID-19 yesterday and 62 in critical care. So we are making preparations and preparing the way for that. And finally, I want to just take you through an update on our accelerated booster campaign. It is worth remembering the significant strides in immunization that we've made in combating this pandemic. This includes a major vaccine campaign with 9,337,772 COVID-19 vaccines administered, 4,111,560 British Columbians vaccinated with 2 doses, more than 125,000 children 5 to 11 now vaccinated with their pediatric COVID vaccine. With respect to boosters, as of today, 858,774 boosters have been administered in BC. That's significantly more, 128,000 more than originally was to be forecast by the end of 2021 in the plan we laid out in October. That includes 503,870 for people aged 70 and above, 591,983 for people aged 65 and above. That's 56% of the total. 84,000 healthcare workers, 151,621 people who are clinically extremely vulnerable, and 34,168 people living in assisted living and long-term care. More than 50% of Indigenous people in BC have received their booster dose. And the number of British Columbians with boosters will continue to grow as we expand and accelerate the booster program. In the last 10 days, 210,000 people have received invitations for their booster shots. In addition, 135,000 people aged 61 and 62 become eligible and will receive their invitations in the next 24 hours. Another 30,000 people aged 60 will hit 6 months this week, and invitations from them will go out also starting tomorrow. And we continue to go out daily with invites for those who become eligible based on their intervals. Anyone 70 plus, that's a 5-month interval. Healthcare workers, clinically extremely vulnerable in all categories, including the third group, and people who received AstraZeneca for doses 1 and 2. Indigenous people 18 and above on a 5-month interval. Our vaccination clinics are running at expanded capacity, thanks in large part to the more than 500 community pharmacies that are involved in the program, who this week did 48,000 immunizations, with more to come every week for the next 5 weeks. Health authority clinics and pharmacies have more than 482,000 open appointments now through January 30th, and more appointments are being added every day and every week. For the remainder of this week, for example, we have 12,000 available appointments. If you're one of the 240,000 British Columbians who've gotten your booster invitation but you haven't booked your appointment yet, do it now. Getting your booster protects you, protects those around you, and helps our healthcare workers. And this is especially important for those who are healthcare workers, who've received the invitation to book. They need to get their booster doses today. There's always thought, I think, in this time of year, what the year ahead will hold. And this year, especially at this moment in our BC pandemic, it is, I believe, reassuring to remember that so much of what lies ahead remains within our control. It doesn't feel that way with the Omicron variant of concern, and yet it's the case. Getting vaccinated, getting our boosters, protecting our children aged 5 to 11 with their vaccines, adhering to public health orders, following the latest public health guidance, and using our COVID sense. All these give us control over a virus that spreads to live and seeks out every opportunity we give it to spread, renewing our commitment to taking these actions, especially when we're tired and worn down by COVID. If we take each of these actions, if we do this, then the promise of 2020 will be that which we would hope for such a year. And it's the greatest chance for experiencing a 2022, I should say, that works well for everybody, is to do exactly that, to use the control we have to protect ourselves, to protect our families, to protect our communities, to protect our friends, to protect our province, and to help people around our country and our world, to protect all of us from the COVID-19 pandemic. With that, we're happy to take your questions.